Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Did you know that having endometriosis when you're younger can have a negative impact on your bones? Well, most people don't even know that there's a relationship between endometriosis and osteoporosis. Well, our special guest, Dr. Jessica Drummond, is going to enlighten us to this important and fascinating topic. Jessica is the founder and CEO of the Integrative Women's Health Institute and the author of Outsmart Endometriosis. She's passionate about caring for and empowering women who struggle with women's and pelvic health conditions. She's equally passionate about educating and supporting clinicians in confidently and safely using integrative tools to transform women's and pelvic health care. Having 2 decades of experience in women's and pelvic health as a physical therapist and functional nutritionist, plus owning a private women's health clinic, nutrition and coaching practice, gives Jessica this unique perspective on the integrative, conservative options for pelvic pain management, hormone balance, preconception and fertility support, postpartum recovery, chronic pain and fatigue that she manages in active women, athletes. She's really very, very special. And I love this interview today because it brings out so many things that we can do and help people who have endometriosis. And my belief is that if we nip things in the bud, if we catch them early and treat them appropriately, guess what? We don't have to have the osteoporosis and bone loss that we have today. So that's why I'm really thrilled to have Jessica here today. And in the interview, we really go over some important topics, the relationship between endometriosis and bone health, as well as what can be done so that people do not have to suffer with endometriosis. So stay tuned for this exciting interview. Welcome, Jessica. I am just absolutely thrilled to have you here. You know, we met several years ago, and I was so excited to see another physical therapist who's doing so much in the world. I mean, I can't get over you're impacting people really all over the world. You have people in your programs, and you're just getting these fabulous messages out. So I'm really excited to have you here, and especially with your new book and this topic. And the reason I was really thrilled was because it's something that most people don't really think about. Like when they think about endometriosis, they think about young women, and they don't see that there's a correlation with possible bone health in the future. And there's a huge correlation. And that's sort of what I wanted you on here for as well, to enlighten people, because there's things we can do at a young age as we get older, but there's a lot that we can do and that you talk about that I think could really help our community as well as their children. And just if we get people when they're young, then guess what? They don't have to have bone problems as they age. And so anyway, so why don't we just get started about the relationship with osteoporosis and endometriosis? Like, how is there a link, and how is it that treating endometriosis could actually be causing problems with bone loss?
Thank you. And thank you so much for having me here. It's my pleasure. So endometriosis is a condition that definitely has a genetic basis, but it's also inflammatory. There may be autoimmune components. And so the disease process itself, the inflammatory process, could certainly cause, increased risk for bone density challenges, because endometriosis generally shows up, it presents a couple of years prior to puberty. So when girls are just starting, prior to the first period, right? When girls are starting to be more exposed to estrogen, and depending on the kind of lesion, Some endometriosis lesions are fed more by estrogen, some more by progesterone, some both, some neither. So it's a little bit like cancer. It's these lesions that can be influenced by the biochemistry around it. So if you think about cancer, cancer is a growing tumor. It's a lesion that, for example, in breast cancer can be fed, grown, proliferated by estrogen in some cases. Sometimes it's by inflammation. So endometriosis is the same. The only difference between endometriosis and cancer is that endometriosis is not cancerous. So generally speaking, people don't die from endometriosis, but it can be very quality of life threatening. It can cause very severe pain, pelvic pain. It can cause infertility. It can cause fatigue. It can cause digestive issues. And it can also cause anxiety, depression, mental health, mood issues, because like cancer, where it grows, so it's tissue that is similar to the tissue that lines the inside of the uterus, but is not exactly the same. So you can have endometriosis growths and lesions. Generally, they tend to be in the abdominal pelvic region. They're outside of the ovaries, they're on the bowel, they're outside of the uterus, they're between the bowel and the uterus, they're behind the vagina, like they're somewhere in the pelvis, these growths, but they can be on the lungs, they found them in the nose, they found them in the knees. So these growths can be anywhere like cancer. So because it's an inflammatory condition, at least in part, the lesions are influenced by any generalized body inflammation. So if someone's eating a lot of sugar, they're under a lot of stress, they're exposed to environmental chemicals, and their inflammatory response is always going. They're always inflamed. That is a part of the disease process. So similar to bone health, certainly your bones are not going to be optimally dense if the body is under chronic inflammation for a number of reasons. One of the simplest is that in order to absorb nutrients, the lining of the small intestine has to be optimized. We get most of our, you put any food in your mouth, chew it, hopefully really well, then it goes to your stomach. It gets broken down further there, and in the small intestine, the beginning of the small intestine, it keeps getting broken down. But generally in the small intestine, the vast majority of nutrients are brought in. So your calcium, your proteins, your other minerals, which help build bone sustainably for the long term. But if the lining of the small intestine is inflamed, you don't get all those good bone building nutrients in. And we know that for bones, we really want to get those nutrients optimized as soon as possible. Puberty is when you build bone health for your 80s, right? When you're in middle school, when you're a teenager. So if you have endometriosis that begins to present with vigor in your middle school and high school years, you're not eating well, you have digestive issues, you've got digestive inflammation, everything kind of bothers your stomach. You're not having a great nutrient-dense diet that gets you the minerals, the calcium, magnesium, potassium, the proteins, the amino acids that you need to build bone in that really important time, because a lot of girls with intense pain from endometriosis have trouble eating because of all the digestive issues.
It's so interesting because everybody knows about anorexia, and that's something that, when people are doing an intake, when you were younger, did you have anorexia? And they may ask digestive issues, but people may not say they did. They just had endometriosis and pain, but all of that goes along with it. So I think it's something that we really need to bring out, because it, as you mentioned, there's so many ways that it can influence bone. And then the treatment, do we want to go into that? How the treatment can have a significant impact on bone density.
Right, and one thing that you said before we move to that that's really important is a lot of people think of endometriosis, the only symptom, as being intense pelvic pain, intense period pain. In teenagers, the pain tends to be non-cyclical, so it's not necessarily during the menstrual cycle. It can be premenstrual or menstrual, but it could be at any time. And so then it's confusing. It's like, is this a gut issue? Is this a pelvic health issue? And most practitioners aren't thinking, and like school nurses aren't thinking that, you know, a girl at 9 years old who has kind of chronic pelvic and digestive issues might not even screen for endometriosis. So the average time to diagnosis was 15 years when I started this work, and it's now better at 8 years, but you could be suffering from this for a really long time before anyone puts those things together. You know, you get sent to the GI and you get sent to the gynecologist, and no one's really thinking of this as a root cause similar problem. And then if you are diagnosed with endometriosis, and some people aren't diagnosed till their 20s, 30s, 40s, you can even have endometriosis post-menopausally. We used to think it was only estrogen dependent, but we know that's not true. So we know now that's not true, but most gynecologists don't now know that's not true. In fact, another gynecologic myth that's often perpetuated is that pregnancy cures endometriosis. So that's also not true. But there are a lot of myths about endometriosis that keep people from being diagnosed later if that diagnosis window of the teens and 20s was missed. So, and then going back to your question about the treatment. So because we've always kind of thought of endometriosis as being an estrogen-fed disease, many of the treatments are pretty intense estrogen suppression. So drugs that really put people into kind of a chemical menopause in their younger years. And the challenge with that, now sometimes it's effective. Sometimes it does really help the symptoms about 30% of the time, and 30% of the people is sort of the average of all the studies of all the drugs that we have in this sense. So I don't discount their use. I think sometimes there's a reasonable, why you would sometimes use these drugs is very reasonable, especially as a short-term solution while you're considering all the other options that I outline in the book, and or excision surgery, which is the ideal surgery to use in these cases. But when you suppress estrogen for any length of time in, you know, the premenopausal years, especially teens and 20s, again, you're really missing that window of building bone density. And this is when we have this vast opportunity, teens, 20s, even a little bit in the 30s and 40s. But if you've had your estrogen suppressed for a really long time, whether it's through hormonal birth control or other more aggressive drugs, that can absolutely help impact bone health, and it can impact cardiovascular health and risk for dementia once you hit menopause and post-menopause.
Wow, so it's so very, very important to catch it young. Let's just go there for a minute. So what symptoms would you say for people listening that maybe is missed? Because how often do you see commonly that it is missed?
Yeah, it takes an average of 8 years to diagnosis at this point. So I would be looking, you know, we want to train every school nurse in the world to be screening for this, right? And there's a nonprofit organization that put out a movie called Endo What? And they have a great nonprofit arm that trains school nurses in starting to recognize and screen for endometriosis. 1 in 10 people with uteruses have endometriosis.
And that's huge. That's a large number, 1 in 10.
It's 176 million people.
Wow.
And if you sit and look at your average middle school English class, there are probably 20 girls, well, between 10 and 20 girls in that class if it's an all-girl school or a co-ed school. So 1 to 2 girls in every single middle school class in the U.S. has endometriosis.
Wow.
And what the picture looks like usually, now endometriosis can vary a lot in presentation. You can have super intense pain that keeps you really debilitated for years, digestive issues, and some people it can be silent. You may not know you have endometriosis ever, or until you try to get pregnant. So, you know, it could be a primary cause of the infertility, but you didn't have any pain, or not pain that was recognizable to you or affecting your life, so you didn't maybe take any action earlier. Now, because there's a genetic component, what we often see is a girl, let's say 11, 12 years old in 7th grade, who has even a history, even up to then, of digestive issues, anxiety, depression, fatigue, difficulty going to school, and then as her periods begin to regulate, painful periods like killer cramps are just never normal. In fact, really, women should not have period pain. Mild, one day of a little bit of cramping, a little bit of fatigue is normal. Like you might notice you're having a period, but it should never impact your life in the sense that you should never feel like you have to stay home from school or work. It's not an illness. So that's a red flag. Some people call the menstrual cycle the 5th vital sign because, you know, you should have a period every month at a pretty regular rate that's not excessively heavy, that's not painful, that's not, you know, keeping you in bed. But because this runs in families, often it's normalized within the family. So if you're 11 and you have these painful cramps, your mom might have had them too if she also had endometriosis, but maybe was never even diagnosed. So she's like, oh, you know, this is what happens. You're going to start getting your period now. Just take the first, 2 days of every month and just crawl in the fetal position. I'll give you as much ibuprofen as we have, and then we'll go to school. I'll just write you a note. Grandma had this too. Your Aunt Betty had this too, right? And so even within families, it can become normalized because we have a cultural myth that women, have to endure this period pain. That's part of being a woman, right? And we need to break that cycle because that is when we should be diagnosing girls. The surgery is easier. You can start implementing all the strategies in my book early on, which make them even more effective. You can preserve fertility, and also something like, the statistic is escaping me now, but it's anywhere between 75 and 95% of women with endometriosis, their careers and their work life and their school life get derailed. They don't hit their potential.
Oh, how sad is that? That is so sad. But good that it can be prevented. That's the exciting news. It's empowering that we can do something about it.
Absolutely, because if you recognize this in a middle school girl and you have the right surgery, you implement all the strategies in my book, you work with a skilled team, then it's not like she has to keep dropping out of college because of the pain, or she doesn't do well on her AP exam, or she has to quit the high school volleyball team because she doesn't understand why she has what seems like random but intense digestive and pelvic pain. So that's why this is so important. I've had so many patients who are actors and new lawyers and new healthcare professionals who really struggled. They're really good at kind of powering through, but they really struggled to just finish college and law school because if you have an unpredictable, intense amount of pain, at least 2 to 3 days of every single month, that's always going to impact your book report, your presentation, the field hockey state championships, your audition, the day you have to show up at, your interview, right? So it can really derail your life progress.
And so someone who does have these awful periods, who would be the person they would go to? What would be step one for this diagnosis?
Step one would be to talk to your gynecologist, but ultimately you want to talk to a gynecologic surgeon, which all gynecologists are surgeons, who is specializing in endometriosis. So there's a great Facebook group called Nancy's Nook. It's huge. It's like 90 or 100,000 people. And in that Facebook group, they do have a lot of recommendations about practitioners, or OBGYN practitioners who specialize in endometriosis excision surgery. A good idea to have a consult with someone like that. A good idea to have a consult with a pelvic health physical therapist. Pelvic health physical therapist experts are brilliant at recognizing endometriosis signs and symptoms, getting the right team together, and doing a lot of the therapies and even nutritional and lifestyle to be able to minimize the symptoms as you're navigating whatever it is you're building your team. Because not every single person with endometriosis needs or is willing to have surgery. Not every person with endometriosis benefits from jumping straight to pain management. Sometimes you do need medication. There are other, therapies, but ultimately you want to put together a team. And that's why I wrote Outsmart Endometriosis, because it helps you find those uniquely qualified practitioners who've been studying endometriosis as a specialty. It's not just like, oh, I deliver babies, 90% of the time, and then occasionally I think I see someone with endometriosis, I'm not sure. You really need someone who dedicates their practice primarily to pelvic pain or endometriosis.
And then I know you teach physical therapists this.
Mm-hmm.
I know you, and it's amazing how much you've contributed to the field of physical therapy with what you've done. But do you have a list of the therapists? Is that something that you have, that people you've trained, or?
Yes, we have a practitioner directory on our website at Integrative womenshealthinstitute.com.
Oh, perfect.
Also, yep. And I also have colleagues, Pelvic Guru. Pelvicguru.com is a global pelvic health directory of not just physical therapists, but other urogynecologists, gynecologist specialists, endometriosis surgeons. It's still being built out. But that's another good resource. Pelvicrehab.com, I think, is the other US-based place to find pelvic physical therapists. So if you ever can't find a pelvic physical therapist in your area, just, send us a direct message on email or Instagram or Facebook or anywhere, Twitter, and we'll help you navigate. There are a lot of good directories online to help you find people relatively close to you.
And it's very different. It's not typical physical therapy, and you really need specialized. I know I took one course and I'm like, no, that's not for me. It's very different. It's very different, and you really need to work with someone who's had that specific training, because a regular physical therapist really will not be able to help you with this.
True. It has to be a pelvic health specialist, physical therapist. And increasingly, there are health coaches and nutritionists that we've trained to help you, again, pull together that team and help you navigate the daily life changes that you need to make, whether you're having surgery or not, pre and post surgery, pre and post PT appointments. Sometimes, the PT appointments can actually increase the pain in the short term because they're moving tissues, strengthening, relaxation, working on nervous system down training. But if you're also implementing lifestyle changes and nutrition changes and sleep changes and all the things we outline in the book, and with the support of a health coach, your recovery and your symptom management will be so much faster.
Why don't we go there a little bit? I know the book is incredible, and I know it just came out, but I was so fortunate to be able to read it, and you give so much. It really goes into detail, but let's just give everyone, why is the food so important? Because especially for teenagers and people in that age group, they really, when you start telling them about the food, they give you the eyes like, come on, how powerful can that be? But it really is powerful. So why don't you just fill us in on why the food is so critical in the management of endometriosis?
Absolutely. Now, I have a 16-year-old. I know that 16-year-olds are going to eat pizza unless they really can't. But for someone who's struggling with intense pain that's taking them out of their school goals, their sports goals, their social goals, the social piece is the part that we have to, that's why I strongly recommend people work with health coaches to implement this food plan, because we can make pizza. Hey, cauliflower can be pizza now, right? So we can make this work for you. But the reason that food is so important is if you're on an anti-inflammatory food plan, it's just like, so if you have cancer and you have a cancer tumor, but you don't have any inflammation, you also could have Alzheimer's. You could have all the signs of Alzheimer's, tangles and plaques in the brain. But if you don't have systemic inflammation, you don't have dementia. If you have a cancer lesion, but you don't have systemic inflammation, it's much less likely that that cancer is going to kill you or progress, right? So it's the same thing with endometriosis. You might have the lesion, or you might have even had excision surgery and had the lesions removed, But now you've got to lower inflammation and optimize immune health so that we can manage the symptoms better and have those lesions be less impactful on your fertility, on your hormone health, on your sexual health, and on your day-to-day life functioning, your anxiety, your fatigue, your digestive function. So the food really is foundational for that, as is what I like to call kind of an anti-inflammatory life. So you could be eating just a brilliant, like colorful vegetables, lots of great proteins, blah, 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 great diet, lots of good healthy fats. But, and also one thing I would like to say is the endometriosis diet, that's not a thing. Like it's about your body figuring out the best foods for you. There's no such thing as a one-size-fits-all endo diet. I wish there were, because it'd be a lot easier, but there's not. That's why I do suggest that you work with a practitioner, or at least follow the steps in the book so that you can figure out your endometriosis diet. And it may change. For example, if you get pregnant or you have a surgery or you're under a lot of stress, the food plan is a therapeutic support tool that can vary a little bit. But ultimately, it's going to be an anti-inflammatory kind of food plan. And if you do that in context of an anti-inflammatory life, so things like daily mindfulness or prayer, things like breath work, things like nervous system down training, if your brain puts out more pain signals when it feels like you're in a dangerous situation. Your brain is not designed to keep you comfortable and pain-free. Your brain is designed to keep you alive. And sometimes that if there's any chronic danger, it's going to keep sending danger signals, otherwise experienced as pain. So we need to, have nature exposure, lower the chemical exposure, have support systems, have a system for what you do when you're going to have to miss school or work so you don't have anxiety around that. Just really build what I like to think of as an anti-inflammatory life so that the anti-inflammatory food and the surgery and even medication if you need it, or injections or any other kind of therapeutic tool, pelvic physical therapy, will work better. If you're living in a pressure cooker life and eating a lot of sugar and, drinking coffee and wine to kind of calm your brain and get it moving again, all the other therapies that we have just simply don't work as well.
Well, the interesting thing is all of those things affect every aspect of a person's life. Every single one of those affect your bones. Every single one of those affect your joints, your heart. So the interesting thing is, take a young person. I know I started meditation. I had been working as a physical therapist, shoving my food in, not really practicing what I preach until I took a meditation course and realized how critical this was and how life-changing. But think about that. If a young person, this is what I believe in life, where the silver lining comes in. Okay, you have endometriosis, but because of that, you have to learn breath work. You have to learn techniques to keep you relaxed and not get crazy. And so your life is going to be really so much better, and you'll be much healthier and live longer. So there's a real upside, even though it may not seem like it, but these things are so, so powerful. So I love that you bring them up, and that it's an important part besides the diet, the anti-inflammatory lifestyle. That's great.
Yeah, and I love working with teenagers and girls in college, and really increasingly younger girls are very motivated. They really, they understand wellness. There's a wellness influence in high schools and colleges, and, there is certainly a subset of teenagers who are really less interested in partying and more interested in kind of from the beginning living a healthy life, because it can be so much more fulfilling. I got really sick myself after the birth of my first daughter when I was about 30, in my early 30s. And I agree with you. Like, in a way, it would have been better if that had happened sooner. I pushed through for a really long time through college and graduate school, but I am way healthier now than I probably was, in my late 20s when, I was like I was working a lot in a trauma center hospital, living on, margaritas and tacos. And not living on, but, it was just, it wasn't something I even thought about, which I suppose is good. I mean, I had generally good health, but the crash in my early 30s really helped me to change my health so much that now at 45, I'm really in much more optimal health than I even realized. So if I had known about that and been able to do it in my teens, 20s, 30s, think of how much more productive and even just healthier I could have been.
Yeah, because what I see, I have children who are in their 20s almost, and one's actually 30. And what I see, though, in those first years of working, people, I know my nephew just started a job, and he's like, everybody, there's lines for the bathroom. Everybody has digestive issues. I couldn't believe what he was telling me. And I thought, that is just so sad. This has to become a part of the culture. Not that we want people to get endometriosis so that they deal with it, but really everybody listening, just as soon as you can start these habits, they are completely life-changing. But so we could go on and on, but yes, I think that's so very important. And I think that, that's what I love about your book. You really outline the steps that people can take so that they can treat it in a different way. It's a holistic way of looking at endometriosis. It's not like, well, what's the medicine? What's this? What's that? It's really looking at a person's life. And obviously you found it effective. Can you just
Absolutely.
a couple minutes saying what you found in your, because you've been doing this a long time now. So what you found with your clinical practice and all the practitioners that you've been teaching for so many years.
Absolutely. So I've been working with clients with endometriosis as a pelvic physical therapist since about 2000, so almost 20 years now.
Yeah.
And in physical therapy, there's so much we can do to relieve and reduce pelvic pain, but there were a certain subset of patients with endometriosis, vulvodynia, bladder pain syndromes, back pain, chronic joint pain, that we just we would get stuck. And having my own experience of kind of improving my hormones and improving my inflammatory responses, I thought, what if I bring this back to my patients with most challenging chronic pain conditions, and let's see if it works. And really, ultimately, that's what I did. So about 10 years ago, I started combining the two, which is why I believe so much in having this team approach. Because, I have had women who they were going to have a hysterectomy, which, by the way, does not cure endometriosis. Endometriosis is, by definition, outside of the uterus, but it can be appropriate in cases of adenomyosis. There's some reasons that we could go into that might take us on a bit of a tangent.
Yeah.
But bottom line, I've had patients who were going to have very complex surgeries, hysterectomies, had been on lifelong medications with serious side effects that completely resolved their symptoms within 3 to 12 months.
That's just so encouraging and so wonderful to hear. And that's why I love what you do, and that's why I wanted to have you on here, because, yes, down the road we can have problems with our bones, and, then there is a relationship. And so the sooner we can get to it, the better the person's going to be. It's just such a win-win situation. So is there any last-minute things you want to say to anybody?
Well, I would say if you're a practitioner, we offer training in this specifically for people who work with patients with endometriosis in their practice. Any level of practitioner, wellness, gynecologists, physical therapists, acupuncturists, nutritionists, health coaches. And if you're a person struggling with endometriosis, I do still see patients in the clinic, and I have a group of health coaches who work with me that we would love to help you navigate the book. The book, you can do it yourself if you're that kind of a person, but I've learned through writing a book that only 1% of people who actually purchase a book, only 4% even open it and read it. So if you bought it and never read half the books that are on your shelf, you're like everybody else, so don't feel shame about that. And only 1% can really take something that's a little complicated like this and execute it. And that's probably because that person, already had a lot of training in it. So we have health coaches available to help you through the pieces of the book so that you can be successful in getting your best results.
Oh, well, I can't thank you enough. And I'll have all the links. And you're just such a great resource. And, I think that's also what's so special about you. It's not that you yourself have done this, but I mean, Jessica's being very modest. She teaches physical therapists all over the world. She travels all over the place spreading this important information because it is so life-changing. So, and that's what we want to
Thank
do.
you.
We don't want anybody suffering because they
Absolutely.
don't have to. And then there's things that can be done. So thank you so much for being on. It's always a pleasure seeing you. And good luck with the book. I know it's going to help people all over. So thanks again. And
Thank you.
And we'll be in touch.
I hope you've enjoyed this interview with Jessica as much as I have and have a new appreciation and understanding of endometriosis. I firmly believe that if we can recognize it and take steps early on to treat it, then people don't have to suffer the negative consequences on their bones and overall health. All the links that Jessica mentioned are in the show notes, and the link to her book also comes with some great bonuses. So look at all of those, and goodbye for now, and look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.